Hi, my name is Lois, and I'm a patient of Dr. Mohrdar's. I've been seeing him now for 4.5 years, and when I first started coming to him, I didn't know what was wrong with me, other than that I was really tired. I had real bad problems with my periods. I was cramping a lot. I was sick and headachy and achy, and I just didn't feel good. I had an old whiplash injury. Well, it'd be about 5 years old by the time I started seeing Dr. Mohrdar, and it just wasn't getting better. And I didn't know why. I thought, why is my neck acting up? Why, and it was, all I could do was work, and on my days off, rest. And that was the only way I could function. I went to see my gynecologist, which was my yearly checkup, and he put me in the hospital overnight because my blood pressure was high. He admitted me overnight and had an endocrinologist specialist come and see me, who said there was nothing wrong with my thyroid. It gave me blood pressure medicine, and it finally brought it down that night. Anyways, I saw Dr. Mohrdar for the second time, and the blood tests had come back, and he said it definitely was my thyroid. The tests he did were different than the tests that other doctors had done, and he explained to me that he ordered special blood tests that these other doctors hadn't ordered. And so when he saw me, he had already had the blood tests back, and knew it was my thyroid, but he also did a complete physical, and he was very thorough. So it's been a long haul. The first 6 months he had me on medication as well as homeopathic, and I started feeling better. And he tried tapering me, thinking that maybe I could do it. He started tapering me off of some of my thyroid medicine, and I just bottomed right out again. I just went right back down to being so tired I couldn't function. So the next time I saw him, I just told him, and he said, "Oh, we've got to get you back on it." And so he started me back on the dose he had me originally on of the thyroid medicine. He kept me on all the homeopathic, which was medications that he had mixed up himself. They might be liquids or whatever, things that to help with inflammation in the tissues, which I didn't even know I had, but internally he helped. He put me on a powder that I was to drink that was for my female hormones, and gradually my periods started getting better, where I wasn't having such bad and severe cramping. I wasn't nauseous anymore. I started actually feeling human. I am so grateful for Dr. Mohrdar and everything that he's done, because he's, without him, I think I don't know where I'd be. I guess I'd still be thinking this was life, where I just work and go home and couldn't function, had to rest because my neck was acting up, or had to rest because I was so tired and couldn't do the things that I wanted to do, and was basically work and home, work and home. So anyways, he's the only one that's helped me. I would say give him a try. When you talk to him, he is so knowledgeable, and he is an MD. He went to med school in Europe, and he is trained in that, but he's also a chemist. But he can talk on your level, and he can tell you in your understanding and your terminology why things are doing in your body what they're doing, why what he's giving you to take is going to work. He won't sugarcoat it as far as saying, "Oh yeah, I'll have you better in 5 months," or "I'll have you better in 6 months." When I asked him how long it was going to take for my thyroid, he just said, "A long time." And I said, "Well, how long?" And he wouldn't answer. He just said, "A long time." And at the time, I thought, well, maybe a year. When the year came and I still wasn't better, he said, "Not yet, Lois." And I realized that I was feeling better. I was feeling better. So I realized, okay, I had been sick for a long time, and it was going to take, a long time to get well. And that's what he said. He says it's you've been sick, we don't know how long. He said, maybe 10 years, maybe 15. And he said, so you can't expect to get well in 6 months or a year.